Hey guys, it's Dr. Dadvand here, board certified plastic surgeon here in Los Angeles, and welcome back to my YouTube channel. So my channel is dedicated to plastic surgery of the breast and body with a specific focus on gynecomastia and FTM top surgery. So what happens if you develop scar tissue after your gynecomastia surgery? Now, by scar tissue, I'm not talking about the actual scar or the incision on the skin. I'm talking about scar tissue that develops underneath the skin. Now, first of all, scar tissue is normal. It's the way the body heals from surgery or any trauma for that matter. But a certain subset of patients develop too much scar tissue. And the reason why this is problematic is because scar tissue in these cases feels like gynecomastia tissue or breast tissue, and sometimes from the outside can look like breast tissue. So in this video, I want to talk about how I approach scar tissue management in my patients in my practice. So scar tissue doesn't happen right away. Usually the earliest you'd see it is maybe a month or two out from surgery, but anytime after that, it can happen because that's the time where the body's laying down a lot of collagen in the healing process, and that's what scar tissue is. It's just heaped up collagen. So in my practice, I approach this with three things. Number one, massage. Number two, kenalog injections. And if all else fails, number three, surgery to cut out the scar. So when a patient comes back for their follow-up, especially when they're more than a month out, I'm always checking to see if they've developed any scar tissue. And if they have, what I do is I show them how to do massage. Now the whole purpose of massage is pressure therapy, to break down that collagen and flatten out that scar tissue. And so how I direct them is, imagine my hand being their chest. I tell them to use the first index finger and the middle finger of their other hand and really firmly press in a circular fashion on the scar, relatively firmly, not so firm that it hurts, but we're not tickling the skin either. We need to apply pressure, and to do this for about 60 seconds a couple times a day, usually either in the shower or to use a little bit of lotion so they don't chafe their skin, and to do that for a couple of weeks and see how the scar reacts. If the scar doesn't react, then we move on to the next thing. So the patient's done a series of massages and it still hasn't shown an improvement in the scar tissue. They come back in and that's when I introduce kenalog. Now, kenalog is an anti-inflammatory steroid and its job is to break down collagen. And that's where scar tissue really is. It's just heaped up collagen. So they'll come to the office, I do the injection in the office, takes about 30 seconds, and I inject the kenalog precisely into the scar tissue so as not to get it into the normal surrounding tissue. And then from there, they don't have to do anything. They don't massage, they can keep working out. I see them back in a couple months and see if they need another injection. Most people do fine with just one shot of kenalog, maybe at the most two. And it really does help with scar tissue. So on the off chance that massage hasn't worked, kenalog hasn't worked, that's when we have to have an honest discussion about going back to the operating room and taking this tissue out. It's very unusual that scar tissue doesn't respond to one or both of those things, but in the case that it does, there's no point in continuing massage or continuing kenalog injections. This is when you just have to go in the operating room and then take the tissue out, the scar tissue out, and then really watch the patient closely over the first couple months at any hint of redeveloping the scar tissue and be more aggressive and more proactive about treating that scar tissue before it really starts to cause a problem. Scar tissue formation, although can happen, is not very typical, but if it does happen, massage is very effective, kenalog is even more effective, and so oftentimes you don't have to go back to the operating room to take out scar tissue. Those two other methods work for the majority of patients, so they don't need another surgery to remove the scar tissue. So I hope you found this video helpful, and if you want more information on all topics gynecomastia, check out my Instagram page, my TikTok page, and of course my YouTube channel. Till next time, guys.